So you're thinking about going to ultrasound school. Maybe you've seen the videos, a dark room, a glowing monitor, and suddenly a heart appears on the screen. It looks incredible. But what you're watching isn't just imaging, it's clinical problem solving happening in real time. And here's the part that almost nobody tells you. Ultrasound school is much harder than most people expect. And the reason has nothing to do with the classroom, it has to do with the probe. And if you're serious about ultrasound, stay with me because one part of this career surprises almost every student. By the end of this video, you'll know whether ultrasound school is the right path for you. First, welcome to the Echo Classroom. My name is Minks Koroma, and I'm a registered sonographer. I hold credentials including RDCS, RDMS, and RVT. Within those main branches, I'm licensed in multiple ultrasound specialties including echocardiography, abdomen, OBGYN, and vascular ultrasound. And on this channel, I help students understand ultrasound and echocardiography in a way that actually makes sense. So, if you're interested in becoming an ultrasound technologist, consider subscribing because we break down ultrasound from the ground up. Now, let's start with the biggest misconception. Most people think ultrasound technologists just take pictures, but that is not what we actually do. Ultrasound uses high-frequency sound waves to create images inside the body. Depending on the specialty, that might mean imaging the heart, blood vessels, a developing baby, or organs such as your liver, your kidneys, and your pancreas. But what makes ultrasound different from many other imaging fields is this. Ultrasound is real-time imaging problem solving. Every patient is different, every body is different, and every scan requires the sonographer to truly think. When you're scanning, you're constantly asking yourself, what structure am I looking at? Is this normal anatomy? What measurements do I need? Am I missing something important? Ultrasound is part anatomy, part imaging, and part detective work. And that is exactly why so many people fall in love with it. But here's something almost every ultrasound student experiences. When you first start school, you will feel completely lost, and that is perfectly okay. Everyone does. You're holding the probe, trying to find the anatomy, trying to remember what your instructor just told you, and staring at a screen that honestly just looks like black, gray, and white noise. You start wondering, how does anyone see anything in this? And one day, something incredible happens. You move the probe slightly, and suddenly you recognize what you're looking at. The heart, a chamber, a blood vessel, and in that moment, something clicks. From that point forward, everything starts building. Most ultrasound programs takes 2 to 4 years, depending on the pathway. During that time, you'll study subjects like anatomy and physiology, ultrasound physics, scanning principles, and medical pathology. But here's what surprises most students. The hardest part isn't the classroom, it's the actual scanning. Because ultrasound is not just academic learning, it is a physical skill. You have to learn how to hold the probe correctly, how to angle it correctly, how to recognize anatomy in motion. Sometimes the structure you're looking for isn't obvious, and finding it takes practice, patience, and repetition. That's why ultrasound students spend hours scanning, and this is the point where many ultrasound students realize something important. Scanning is the hardest part of ultrasound school, but it is also the part that eventually becomes the most rewarding. Because once you start recognizing anatomy consistently, your confidence grows quickly. Eventually, ultrasound students enter clinical rotations. This is where you begin scanning real patients at hospitals and imaging centers. And this is where everything becomes real. Because now you're thinking about probe position, image quality, measurements, anatomy, possible pathology, patient comfort, and clinical reasoning, all at the same time. At first, it feels overwhelming, but slowly with time, you improve, you get better, you gain confidence. And eventually, something surprising happens. You realize you're actually scanning. Now, remember earlier when I mentioned the type of student who struggles the most? It's usually not the student who finds the material difficult, but rather the student who expects scanning to come naturally right away. Ultrasound takes repetition. The students who succeed are the ones who stay patient, keep practicing, keep improving, because being a great sonographer is not about memorizing everything. It's about pattern recognition and clinical thinking. recognizing normal anatomy, detecting subtle abnormality, adjusting your image in real time, and understanding what you are seeing. There's one more thing people should understand about this career. Ultrasound is physically demanding. You may spend hours standing, reaching across a patient, leaning in awkward positions and holding the probe to get that perfect image. And that's why ergonomics is extremely important in this profession. But even with that, many sonographers stay in this field for decades. Why? Because the work itself is meaningful. Every patient is different. Every scan is different. Every exam tells a story. So, the real question becomes, is ultrasound the real career path for you? If you enjoy anatomy, medicine, technology, and problem solving, ultrasound can truly be an incredible career. However, choosing the right school and understanding what you're getting into is extremely important. And that is exactly what we're going to be talking about in this series. In the next videos, I'm going to break down how much ultrasound technologists actually make, how to choose the right ultrasound school, the biggest mistakes students make when applying, and what many sonographers wish they knew before starting. Because if you're serious about becoming a sonographer, there are things you should know before you ever step into a classroom. If you're interested in ultrasound, echocardiography, and medical imaging, make sure you subscribe to the Echo Classroom. Because on this channel, we break down ultrasound education, echocardiography concepts, registry preparation, and real clinical scanning knowledge in a way that actually makes sense. And if I'm being honest, if I could do it again, I would choose this career in a heartbeat, because ultrasound has given me the opportunity to work in medicine, help patients, and teach students how to understand the heart. And if you're serious about this career, well, you're in the right place.